Board. All right. Good evening, everyone. This is the meeting of the Health Hospitals and Social Services Committee for Community Board 8 in the Bronx. I believe that it is now 7:05 p.m. and I would like to call the meeting to order. And we'd like to start with roll call and welcome. So start with the welcome roll call. We have present Wayne DeBeetham, its chair, Sebastian,
Present.
Steve.
Present.
Excellent. And we would like to acknowledge Julie Reyes, who is the chair for Community Board 8, who is present via Zoom. And I believe we also have some members of the community who are present. We have Jason Lovelace and Haley Cruz. First order of business would be approval of minutes. And would start with the we have the minutes from September 10th, 2025. Would anyone like me to do a quick rundown of the minutes? Or
Motion to approve.
okay,
Second.
meeting. The minutes have been approved. Second, approved and seconded. We have 3 of us present. All in favor of approving the minutes as stated?
All in favor.
Well, unanimous, okay.
Yep.
Excellent. So report, I'd like to go over, I think we have the agenda today. So that being done, report. So we last met in September. At that time, we discussed a few things, but there was a SAPO application for the James Baldwin Outdoor Learning Center, which was approved. That occurred on September 13th. We also discussed at length goal settings and some of the things that we would like to do as a committee, which is also included in the minutes. And some of the topics are things that we would like to, I think, flesh out in future meetings. Like to do, and we can certainly have a discussion as to when we would like to do that and how we would go about that and kind of what our priorities are. In addition, I think Steve was kind enough to list some area pharmacies based off of our conversation from before, with places where that have in our region that provide both flu and COVID shots, and I'd like to thank him for creating that list. And I think I will at the end of this meeting, I think we can release that, and we can certainly talk about the next steps in terms of making sure that the community is available for the resources that are there. Yes, please. Thank you. Additionally, I was able to get in contact with the chair of the Health Services in the State Senate, who would certainly be interested in having a meeting and just talking with us about some of our priorities and some of the priorities for the region. And so that is in the works in terms of setting a time and a date, and tentatively maybe December or early January. And I think hopefully at that point we'll be able to talk about some of the things that we would like to prioritize and emphasize for our area. Next up would be review some of the priorities from the prior meeting. At this point, I'd like to open it to discussion. If you'd be so kind to dive into please. Okay. Anyone would like to? It's open for discussion if anyone wants to discuss, talk about some of the things that we reviewed at the last, some of those goals and some of the things that we discussed at the last meeting. Would you like me to list the,
There were more people.
yeah, there were people.
Okay.
I believe we discussed about someone to come in to discuss about the big beautiful bill and the impact, right? You know, have someone present
Mhm.
to the community members.
I think it can building sheets.
Have either of you had any effect on your practices?
I work for the city. So, um. Not my team directly, my leadership has been very good at communicating that, fortunately, New York City is in a much better position than a lot of other health departments in that our funding is pretty diversified, it's. I wanna, let me not say, I can't remember the number they gave us, but, we get federal, state, city grants, whereas a lot of other municipalities, it's like 70 to 80% federal funding, so,
Have any of the federal grants been pulled?
I think either they were pulled or like lines were vacant that we declined to fill, in anticipation of trying not to, um. Have to lay people off or anything like that. I don't think there's been anything to that scale yet, but also the way that. And please correct me if I misunderstood, but I believe the way that the bill is structured, it's such that they're not all happening at once. There's gonna be stages of this so that. I'll give my thoughts on why.
Well, I think it partially depends upon where the grant is coming from. A lot of the NIH grants were just yanked.
Absolutely.
And it's still continuing with some other grants. I'm actually working on one of them, the BOLD grant.
Mhm.
I was in an hour and a half meeting this afternoon on that as a representative of Montefiore.
Mhm.
And that one is still live and state DOH has one that am involved with. So somewhat to our surprise, that funding continued.
Yeah, I'm not sure of the nuances, but a lot of it is like
Yeah.
what stage you were in when this went, like, I think it might affect.
Well, most
you.
of the NIH grants were research grants,
Mhm.
so it.
And it was also depending on what your topic was.
Yeah.
Some topics got hit harder
Harder
than
than
others.
Um, I think it would be certainly of, and I think if. I think, I think certainly if we, I think have, the state representative, come, we can. Discuss that with him in depth, particularly considering the timing, because a lot of these are being staggered. With, impacts being felt well after election cycles, for reasons that I don't understand. So, I think that's certainly, I think that's a great priority, because again, particularly when we talk about the cuts to Medicaid, Medicare. And the impact for New Yorkers, because they may not necessarily feel it. I obviously another thing that's coming up immediately is with premiums, not only for the the Affordable Care Act, but also insurance premiums in general are
Yes.
rising. And a lot of people are gonna start to see that with open enrollment now.
Yeah.
And so I think Medicaid cuts, issues with insurance enrollment are things I think gonna be high priorities.
I'm wondering if we should make this a larger, like, the effect of politics on health.
Impact of politics.
Because also I don't know what happened with the CR today, because work, but.
I think they're supposed to vote on it
Tonight, yeah,
Yeah.
but that only goes to the end of January.
Right.
And so, there's,
It's gonna start again.
yeah, so, and not only. What it does to our insurance and our premium, but again, social worker, your mental health, to have this instability and uncertainty. as an individual, let alone if you're a caregiver, if you're a primary provider.
But
So much.
one of the things I think will be interesting is if individuals who are on the ACA, the exchange, um, policies decide not to enroll, re-enroll.
Or can't.
And if come January, there's some agreement to restore some of the subsidies, will they be allowed to enroll at that point after the open enrollment period? So,
Yeah, traditionally that's reserved for like things like that, or like significant life events. I don't know.
yes.
if we-
This is,
I think-
I would argue that this isn't a significant life event.
Significant event, indeed.
We would love some precedented times, that would be lovely.
So those, I think those are things, and like I said, I think they are certainly interested in meeting. I think we can put these on the top of the agenda to have that discussed. And also the question of forum, when and if that does occur. This is something that we have here, or if we, try to have it in a larger forum to accommodate more people.
Well, I wonder whether, is it worth trying to get a briefing from, Health and Hospitals, which has 3 facilities in the Bronx, or?
I think, well, that's a lovely idea. I wonder logistically how long that's gonna take to coordinate. I mean, we could ask the office to reach out and see what, or just inquire, what kind of lift it would be for them or for us.
Then it would be the other health systems, Montefiore and, St. Barnabas, and always forget what,
Bronx. Bronx
yeah,
Lebanon?
Bronx, I still call it Bronx Lebanon.
Yeah.
It's still the plan.
Sorry.
And then then the FQHCs,
Right.
so.
Yeah,
The city ought to be,
Front and center.
and the health systems ought to be thinking about that generally, because the CB8 is not the only one that's affected.
well, the committee has, and I was on this committee for several years before I became chair of a different one. They have done like forums. The one that comes to mind is we did a forum on underage drinking and the effect that has, and a school hosted it. We had a panel of, I mean, that is something we could shoot for, but I do think those definitely take a lot longer to plan,
Together,
you know,
yeah.
again.
Well,
But-
yeah, one of the other things to think about is, whether there'll be a new head of H&H and EOH come January. Well, I mean, that obviously won't affect,
Yeah.
staff people, but.
But I do think I think it's a good idea, it's a good target to shoot for. And I think at least if we lay the groundwork, irrespective of changes in leadership, I think if they know that we're engaged and it's something that we want to do. I mean, I do know that at least, like Lincoln, for example, was very, very focused on partnering with stuff in the area. And so we could probably, I think if somebody says, listen, we're from the community board, this is something we'd like to talk to you about. That it's something we might be able to order.
Yeah, I mean, the sense I get, this is my second mayoral transition, is, the high level folks, maybe.
Right.
But the kind of folks that I think are more likely to be able to come to something like this we might be able to start planning, and
Right.
maybe if their boss wants to make an
Right.
appearance, then they can do that, but we could move forward with at least some.
Local regional, like we don't necessarily need the head of HHC coming.
No, I would,
I don't have time for that.
I mean, I would, take the assistant commissioner of public affairs or.
Yeah, they probably have
whatever.
some community liaison or something
Right,
like
something.
that, it's like
Right.
partially their job to do these kinds of things, but having some. Hospital
I
representation.
mean, I wonder whether we ought to talk to the borough president and see whether she and her staff might be interested in doing something
Sure.
that would encompass the whole borough. I mean, with healthcare, regardless of where you live, it's
It impacts.
right? I mean, here in Riverdale, all kinds of people go south to Columbia. So.
But I also think this is something that we could, and if we decide to start planning in earnest, like there are lots of other committees like aging, like veterans, like
Right,
youth,
right.
that we could do a inter-committee kind of sponsored event. You know, reaching out to those committees, gauging their interest.
Madam Chair, your thoughts?
I agree with Julia to start out with the lower level, if that's what you want to say. It would be great if we could get the commissions. We would extend the invitations, but we'll get what we can.
Right.
And to, I would say include like the aging committee.
Mhm.
They had discussions recently similar to what you guys are having. And we can find a nice centralized location that is larger to be able to house everyone who will be interested. And just a reminder, I say this at quite a few committees, because when we speak, we say the people in Riverdale, whatever, but our district, as everyone knows, is much larger than Riverdale, Kingsbridge, Fordham Hill, not Fordham Hill, I wish, and Cortland. Just to hear Riverdale, that the people who will be listening in will feel a
Right.
little disconnected. But I'm listening to your discussions, and it's nice that you guys are planning it. Very nice.
Thank you, thank you. So I think those are things that I think are gonna be at the forefront, and so we'll certainly work on. Formulating something about that and seeing what we can start coordinating and reaching out to. Um. Interested committees.
And that ought to include, I mean, we've been talking health, but that ought to include, social services, as well, the Medicaid,
Right.
unit.
Absolutely. Um. So that's priorities and unfinished business. Like I stated, in the new business, the possibility of that meeting with State Senator Rivera. And as soon as I have more information as to a date, or tentative dates, we can, I'll reach out to you and we can start working on that. Another topic that falls under unfinished / new is as I forgot, we don't have a vice chair. And I think it would be lovely, particularly as the chair happens to be stuck in Iceland.
How often is that gonna happen? How likely is that to happen again? Like.
But
Given the way they've been canceling flights for the last 2 weeks. You could be anywhere.
Anywhere,
It could be
absolutely.
canceled, right?
Also thank you, Sebastian, for covering at the board meeting.
No,
Oh, Julie, Julie. But yeah, it's I would say that if anyone has an interest, you can feel free to throw your hat into the ring. If you want to think about it, you can, you can get back to me and we can distribute that information to the committee as well. And we can talk more about kind of what it entails. Hello, Rabbi.
Sorry for being here. Problem. Can't believe I'm meeting.
All right, and I think up next is just, I think, discussion on our budget priorities. Actually, I think all these topics, which I think we've listed here. In addition, I think, actually had an opportunity to meet with a reporter to discuss, I think we had listed from last year our priorities and talking about the concerns with domestic violence. And they kind of wanted to know what our thoughts were as a committee as well. And so keeping in mind that again, that as well as many other things are listed as our priorities, but is there anything else that stands out things that we want to make sure are listed in the 2028 budget.
Can I ask a clarifying question?
Sure.
And I apologize, I don't remember, but when domestic violence, did we have a specific ask or like just increased funding or like increased funding?
As I recall, and correct me if I'm wrong, I think it was more about just increased funding and increased focus and attention. It was kind of a little,
Yeah, it was to increase, certainly. I think you're right, it's attention to it and the kinds of resources that can be brought to bear. That's the main focus.
just if I can pull it up direct.
My thought was if it was worth kind of parsing out to like increase funding for domestic violence awareness programs and then increase funding for domestic violence support I don't know if it's worth kind of separating that way. I was chair of youth, so we didn't do a ton of budget priorities, so I'm not the most familiar with this.
I can pull that out, let me see.
I believe we also put an emphasis on just mental health
Be correct.
in particular, certainly more resources for folks to be able to access mental health services, and this is just. The Bronx is probably the worst in the entire state. Who we understand and access to mental health services.
Yes, provide additional funding for mental health services focused on trauma, impact of COVID-19. And the world as it is for youth and older adults.
And in regards to domestic violence, it was, again, I think resources. Particularly for like legal services, counseling, further supportive services, and like kind of like you said, globally.
But I've never been able to sort of figure out does this actually happen? Does it actually
Occasionally.
occasionally?
My understanding, and Julie, please correct me if I'm misremembering, is that things that have been on your budget priorities for longer tend to get considered a little more, they have a little more weight to them. And the sense I get, and that's why I was asking about like domestic violence, is I think if it's a more specific ask, it's 50-50 if they're gonna, like, I think the capital improvements, like, we'd like you to fix this, steps here, that's kind of
Right.
easy. I think it gets a little bit of a balance to be specific enough that they can't just be like, oh, we gave money to domestic violence, to what? Of the doors, it's like, that's great, love doors, but.
I think that's a great suggestion. Just to push the question a little bit more. If you're talking about capital improvements, it's easy to sort of like first circle around and say, we're gonna fix this step, or we're gonna fix this street. With the issue of mental health or domestic violence, and they're sort of in the same
Mhm.
pod together, so vast.
True.
So I think focusing it down would be extremely important. And seeing what is real, that whether it's just bringing, there was for instance, a mental health unit of the Jewish board that existed in the community that is no longer here.
Mhm.
I don't think that, to my knowledge, I don't think there's any center for people to receive or to access mental health in the entire district. And I'm just wondering if that exists. And if that doesn't exist,
I don't know, in person,
there may be individuals who go there.
sorry.
But I would like to
Chair
acknowledge,
Hauser.
Madam Chair.
Oh, I'm sorry, I had to unmute. I just wanted to just go back to Julia's inquiry regarding with the budget. Yes, they do prefer that you are more specific, and even if you can have a price attached to what it is that you want. But just by broadly saying domestic violence issues, be more specific and possibly the price, so that if an agency cannot fund it, at least when we go speak to the elected officials, they can see if they could pick up the tab on any specific issues on the budget. And then the police department just opened up. They hadn't really informed us, and we're getting more information on the location for the domestic violence office that they opened up over on Kingsbridge, right next to the mall on 231st. And then as far as for mental issues, you have I'm so used to calling it the Riverdale Mental Health Association right upstairs, where they also assist with mental services.
Okay, thank you. Yeah, I mean, I think that the reality is, I think for many of these things, they are big and they are vast. And I don't think that it would hurt us to, again, the journey of 1,000 miles starts with a single step. So even if we say specifically we want brochures for resources, we can always say next year we can. So I think it'd be good to think about like the list of what all the things that we think are important. And I don't think it hurts us to list them globally and then pick one as our focus of interest or one or two for the focus of a given fiscal year.
So something you just mentioned, I think would be very helpful, because as I said, I'm hard pressed to come up with, who do you turn to? And I imagine most people are equally as hard pressed, certainly in a time of crisis, certainly in a time of response or trauma. You can go online, maybe you'll find something, maybe you won't find something. Perhaps we could request and we'd have to find the organization that would be willing to do it. That maybe the Department of Health and Mental Health would be the right person, agency it's turned to, because they do have, under Rosa Zhao, they do have a Center for Mental Health. To create a resource guide for Community Board 8 of mental health opportunities and domestic violence opportunities, where someone can turn to it, and certainly it have to be online. It have to be multiple languages as well. We have to figure out which languages. But I think that's saying you start with one step. That would be an important first step to really have in the community, so somebody could say, Community Board 18, whether it could be situated on the community board's website, saying these are the resources in this community board that someone can access mental health services or domestic violence services. I think that would be in itself a very powerful step.
That shouldn't be terribly difficult, and if it goes on to the website, it can be continually updated. Right, so we could start with whatever we could collect quickly and just add as. And it's basically, I think, to start with a couple of phone calls or emails to specific city departments. State DOH also has actually good resources online that we could create from, and a couple of phone calls to the various hospitals or would be a start.
So let me focus it a little bit more, and then if we like the idea, perhaps we want funding for an intern. For someone to come on board and to do this, because it would be really helpful to have someone who sort of getting paid to or dedicated to doing exactly that. Going out, identifying the resources, putting it in some sort of format that could easily be translated on board, online, excuse me, and can then turn to certain organizations in the community as we identify different language groups to do translations with various different links and access points.
So I would recommend, please, go ahead.
Now, I know that the Aging Committee, Community Board 8 Aging Committee, is updating the resource guide. I think that is more towards the older populations in this district, but maybe we can be included, or maybe we can ask them how they got their resources and how they got all the information. And we should also see if they have links in their resource guide to domestic violence, mental health resources, etc. So that we're not all working in a silo, but maybe we could work together.
Yeah, excellent.
Thank you. That's very helpful. And I think when we, I think as we discussed earlier, I think one of the concerns that we did have as, for this committee was also the element of, in addition to mental health, but social isolation as a subset, and particularly how that not only impacts youth, but also how it impacts, the older community. And so I think it would be a wonderful idea to pull some ideas from the aging committee and see if we can collaborate with them in that regard. So thank you for that suggestion.
I also
would
wanted to add, the building, the Beekman Center that was under the auspices of the Jewish Board, Family and Children's Services, has a big sign outside it. It's located on 239th Street and Hudson Parkway West, that a new mental health service is going to occupy it, and that Mosaic Mental Health is going to share offices there too. So these are new resources that are coming to the neighborhood, and as a way to introduce them and to support them and to collaborate with them, maybe that is a good opportunity for us to reach out to them.
Yeah, yeah, that's a good point, because I'm happy to see that that building is no longer vacant. And that is actually a wonderful opportunity, I think, to to reach out to them and see if they'd be willing to either collaborate or even just talk about some of the resources that they have. And as they introduce themselves or reintroduce themselves to this region.
I just would like to encourage folks, if you aren't aware, and I'm not sure folks are, NYC 988 is, 988 is the national suicide hotline, but, for New York City, they put under 988, what used to be NYC Well. So that is a 24-hour talks, text, chat, line that usually they have, in addition to suicide counselors, that is also how you would get someone, a mobile crisis team. They would have resources on short-term and long-term connection to care. I know at one point, it's been a while since I've been on the website, you could like put your address in and tell them what you were looking for, and they would, print off a list. So it might be worth looking at or checking in with them to see if they
Is
would
that
give-
under DOH, Julie?
DOH&H holds the contract for Vibrant, who's the ones administering 988.
Yeah, they actually presented to us last year. I think that would be, so I'm looking at Mosaic Mental Health, they seem to be pretty comprehensive in what they provide. Perhaps we invite them down.
Absolutely.
Yeah.
Julie, there's an app for the chat under 998, or is it like you had to go to the website?
I just went to the website and there's like a
Okay,
chat. I don't know what happens when you press.
okay.
Are you sure you're leaving our set? But so I think I'm not sure about like what would happen on a computer as opposed to a mobile device, but and I know at one point, and I think it survived all the cuts, is the LGBTQIA plus youth, especially, they had dedicated resources for. And I think New York City was committed to maintaining those as much as possible with life.
Cool. Thank you. Anything else to think?
But what happens if someone reports a domestic violence? That's what does that person gets?
So there are a few different resources. I do know that there is a domestic violence officer in the 50th precinct. There's a whole subset and an office within that, and I think I would love to look into as
But the person, if person is removed from that situation, right, they end up in a shelter.
Circumstances vary. I think that it's broad, but that is one of the options, certainly. I don't know how well
It could be
enforcement.
it could be a barrier for people too, right? They don't want to end up in shelter. That's I don't know. It should be an expense item, so there should be some other alternative temporary.
I would say that
Because of that shelter, I don't know where that shelter is, but I think it's on the other side of the Bronx.
Well, most domestic violence shelters are anonymous. They're not, you're not supposed to know where they are because then there are some other limitations. My understanding, I haven't actually been to one in more years than makes it relevant. They tend to be more discreet, so it's not these kind of dormitory style. They tend to be semi-private. They
Okay.
tend to have more likely to accommodate children than it's
right.
not gonna be like an intake shelter usually. They try to, there are some limitations with like pets and such. And I'm sure there's limitations with space,
Yeah.
but it also has to be if they're willing to go.
Right,
Because
right.
that's the most dangerous point for someone fleeing domestic violence. And also like the balance of keeping you safe, but keeping everybody else safe too. You cannot then call your abuser and tell them where you are.
Right.
So I mean, I think it generally, if you call in domestic violence like to 911, the police will try to separate you and have
Right.
things cool down, but. And I can't remember if New York State, if the victim has to press charges or if the
Yeah.
police can press charges on their behalf. And even then, like if they don't cooperate, the
Right.
case kind of falls apart and that's why it's called a cycle.
Yeah, it's problematic and yeah, I think, I would say that the infrastructure is. There's a framework. There's a framework, there's concepts of a plan, if I think of many things, like I say, and the challenges, as we know, both in mental health as well as domestic violence, is that there are pieces that are there, but we don't necessarily have turnkey, door-to-door resources available, and I think a lot of times if you make it through the system successfully, you're lucky.
Is 311 equipped to handle domestic violence calls?
I couldn't say with absolute certainty, my instinct is no. Domestic, like, again, usually if you are in the middle of a domestic violence, that is considered a 911
One call.
incident, someone's.
Well, that's right. I mean,
If you're looking for
if
resources.
someone is beating you up or threatening you, but if you're
looking for
if you're
something.
concerned that I'm in a potentially violent relationship or something, where do I go for help?
If someone was asking me personally, I would refer them to 988 before 311. No, 311 kind of is more for city agencies and getting you to the people who like the agency that can
Yeah.
help you, but the city doesn't administer direct services. Also kind of the answer that's always been told to me is.
Maybe if they are going to a safe and discreet setting, maybe that's something that needs to be educated so people can seek that help, right? That people might be worried about where they will end up.
Yeah, I mean, the process of overview, again, not specific locations, could be more transparent, people, like an FAQ about like what happens
Yeah.
if and I would imagine Safe Horizons or someone else that does this daily has something semi-ready to share.
There is information on 311 about regarding domestic violence in terms of, you know, offender counseling transfer. There's information, but I think in terms of
So,
How to navigate
what
this.
all this comes down to is we're headed in the right direction.
yes,
In terms of thinking that the community needs or could benefit from a list of resources. Whether it's printed on paper or posted on the website or,
Yeah.
you know,
where to
where
go, what to
do
do.
I go or what's available to me if?
Right,
And it could be, you know, a whole bunch of ifs, but domestic violence and all kinds of other things.
Absolutely.
My kid needs help or.
Right. What do I do?
I'm concerned.
Yeah.
So,
Absolutely. Okay, excellent. So I would say that at this point, in terms of what has bubbled to the top. For, I think, not only budget priorities, but also think for the most pressing topics that we want to kind of get the ball rolling on. Would be resources and a resource guide for domestic violence as well as mental health. Whether that is starting to accrue those resources, putting it down in the budget to say that we want an intern so that we can formalize and create a kind of a fairly comprehensive list, reaching out to the other stakeholders, the police department, the hospital system, the Department of Mental Health, to collaborate with them and the Department of Committee on Aging, to collaborate with them on some sort of resource guide and kind of community awareness. Which again is big picture, but then enough also fleshing out what our media priorities would be for the budget so that we can start getting these things not only taken care of, but also funded and improved on. Addition, releasing that list of local pharmacies regarding flu vaccines and COVID, not too late.
I want to ask you something, Doctor. Would you consider also including elder abuse?
Absolutely. I think domestic violence, elder abuse, it is an, I mean, when you consider that domestic violence does not necessarily have to be it's part, yes, the short version is yes. It's not exclusively intimate partner, right? I think that when you think about domestic violence, you can make it's close relation violence, right? Someone where there's a relationship and a resource and a need. So I think elder abuse, there's a lot of dovetailing and intersection when we consider social isolation can occur with young people and certainly with the elderly. And I think when we consider that abuse and can occur with intimate partners as well as with caretakers and the elderly. So I think that, as you've mentioned, I think affiliation and collaboration with the Aging Department Committee can certainly be synergistic. Obviously, like I said, we will talk with State Senator Rivera about that meeting. And I think our next December is, let's just pull up our December meeting schedule.
When first Wednesday, second.
Yeah.
So that's never.
We'll get the official date on that. Any other concerns? With that said, do we have a motion to adjourn?
So.
Second.
All in favor?
Aye.
All right.
I have to break that, right? I'm so sorry about that. Love that.
All right, well, I'd like to thank everyone for attending. I'd like to thank, again, winter is not coming, winter is here. So thank you everyone for being here, and I thank you for an excellent lively discussion. And I'm very much looking forward to moving forward with a lot of these topics. The full board meeting is tomorrow, so
Yes.
see you all there. And once we have the exact date for our next meetings, I will be sure to be in contact with you.
Thank you. Good night.
Only.
Thank you. Good night.
Good night, everybody.
I don't put them